Liposuction is one of the most powerful tools in the plastic surgeon's armamentarium, and part of the beauty of it is that it allows us to really sculpt and shape the patient's body from the neck to the arms and the armpits and the back to the waist and the hips and the thighs. Liposuction is a technique that we can use to sculpt and shape just about every part of the body. So it's very powerful. The goal in liposuction is to do that shaping without leaving any external signs, or as few as possible, that any surgery has been done. We try to keep our access incisions small. We try to hide them in wrinkles and skin folds. We try to place them in inconspicuous spots. Just as importantly, we try to leave the contour of the liposuction area as smooth as possible. To do this in our clinic, we are very careful to always preserve a thin layer of fat beneath the skin and to keep that as even as possible. One can then liposuction more aggressively below that, but I believe that establishing that plane very carefully at the onset of liposuction to maintain an even contour is extremely, extremely important. We frequently pair liposuction with other surgical procedures that we do. It's very powerful and effective as an adjunct in abdominoplasty or tummy tuck surgery. When we perform a facelift or a neck lift, liposuction allows us to contour the jawline and sharpen and define it. It allows us to clean out the submental area, that area of the neck below the chin, and remove the excess fat there. It can really put the finishing touches on a breast augmentation mastopexy case or a breast reduction because these patients often have excess breast tissue and fat that continues into their armpits. And by removing these bulges that frequently you can see pushed over the sides of the bra straps, it can really improve the patient's appearance and also make them much more comfortable. So liposuction is a tool that we employ frequently. Then too, when we use fat transfer to increase the volume in different areas of the patient's face, we use a very careful type of liposuction to preserve the fat cells so that we can transfer them and they can still be alive and thrive in their new location. When we do liposuction, we like to use the finest cannulas we can for each job that we're doing. Place them carefully, gently, try to minimize bruising and bleeding. That reduces swelling and black and blue after the surgery, but it also allows the patients a much swifter and more gentle recovery and a faster return to their activities, which we try to achieve in all the procedures that we do, and yields a much higher patient satisfaction in our practice.